Hi, Dr. Klaper. Thanks for taking my call.
You bet.
I am also one of those people who needs to reverse coronary blocked arteries. I have atherosclerosis since I've been 55. I'm 72. I've been vegan. I'm now considering Dr. Esselstyn's program, but I was confused by your comments because someone recently asked you the question about healthy fats and reversing blood pressure and cardiovascular disease, and you said it was important. Yet Dr. Esselstyn's program allows for only 1 or 2 tablespoons of flax or chia a day. Can you clarify, please?
Oh, absolutely. Thank you for making me clarify that. That's an important distinction. For most folks who do not have artery disease, I don't think they have a problem of putting a slice of avocado on their salad or throw a handful of walnuts on their oatmeal in the morning. And again, you need some fats every day. But if you are someone with clinical artery disease, you've got angina when you walk, you've got a blue leg that's not getting circulation, you've got official artery disease. Fats, except the bare minimum, are not your friends. Dr. Esselstyn is right. And if you really want to initiate those plaques melting away off the artery walls, then you got to be on a really low-fat diet. Not forever and ever. 6, 12, 18 months, 2 years, whatever, till you're symptom-free, till your inflammatory markers are down. So the ultrasound shows you got good blood flow. Then you can add, a handful of olives to your salad or whatever. So again, there's zero in the way of oils. And as far as the whole foods that are fat rich, avocados, nuts, whatever. If you don't have artery disease, have a modest amount of them. If you've got artery disease, be 100% pure Esselstyn and avoid them for a good year or 2 or 3 till you are symptom free and your arteries are clearly healing. I hope that clarifies it.
Thank you. The next up is James. I'm going to unmute you if you could ask your question.
Doc, it's a complete honor talking to you. What would you advise somebody who's almost 7 years into remission from lymphoma and been on a whole food plant-based diet for about 3.5 years? Any words of advice?
Oh my. Well, good for you that you're in remission. And from my experience, I can talk from experience. When I was working at True North Health Center, we had 2 patients come in with lymphomas. And I figured, write their death certificate. Just the opposite happened. We were stunned. Both of them, one did a water fast, one did a juice cleanse. The lymphoma tissue melted away. We've done a 5-year follow-up on one of them. She is clear lymphoma. That particular type of tumor responds really well to a whole food plant-based diet. You don't want to don't want to poke the bear there. Fried foods, oily foods, meats, dairy, I think will wake the dragon up again and help that to grow. But now lymphomas are special cancers. Now, not every cancer responds like this, but lymphomas, they're a distortion of natural tissue of lymphocytes. There's still, there's constant turnover in those cells. Plus lymphomas are watery tumors. And so the changes in your blood from the whole food plant-based diet works its way into the lymphoma tissue and starts working its magic in many different ways, sirtuins, et cetera, et cetera. That's opposed to some of the really gnarly, meaty tumors. If you've got an osteogenic sarcoma of the bone, that doesn't melt away so easy, or a big squamous cell carcinoma of the lung, or bronchogenic carcinoma of the lung. Those are tougher cancers. So in a way, you were, quote, lucky to have a lymphoma, and they do respond. So the best thing is to thine own cells be true. Don't cheat on that lymphoma. It will wake the dragon up. So when you're out at the restaurant, order as clean as you can. When you're shopping, don't bring home the junk foods there. And if you do that, and the green and yellow vegetables are stabilizing in general. And so something green and something yellow should be on your plate pretty much every day. Some steamed greens, some big salad, carrot, squash, etc. for the yellow vegetables. Dr. Joel Fuhrman has a lovely recipe for anti-cancer soup, and it's full of greens and mushrooms, etc. Do a Google search on Dr. Fuhrman's anti-cancer soup and make up a big pot of yourself and have a few cups of that during the week. So those are the things I would do. So you got away, quote, lucky. I mean, if you've been in remission 3 years, so keep eating healthy and clean, have a positive attitude, and hopefully the thing won't come back on you.
Thank you so much. Next up is Sophia.
Hi.
Question.
Hi, do you hear me?
Yes, I can.
Hi, Dr. Klaper. Thank you so much for taking my question. You helped me a lot in the past with the Paddison program used to answer our questions and so on. And my knee, I felt better at a period of time, but unfortunately, synovial inflammation, though I am vegan, keeps up growing. And I even developed a toffee around the muscles, like hard bumps. So I have to put knee braces constantly to be able to stand up. So I wonder what else I can do that I'm missing.
Wow. Didn't catch all that, but your rheumatoid arthritis seems to be getting a bit worse, and you got nodules now in your tissues. Yeah, right. So you're someone who may benefit from repeated brief fasts, a 3-day fast or up to a 5-day fast at home once a month, twice a month. But you don't want to get too skinny, lose too much weight. But we often, when I was at True North, we would have people come in, do a fast, get tremendous response in their tissues. They start eating again, and often there would be a flare up of their tissues. And Dr. Goldhammer would say, man, some of these people got to come in, do 3, 4, 5 fasts before they finally get a hold of this thing, till their gut flora changes, till their joint tissues change. So, but many people can't afford to go to True North Health Center for weeks at a time, many times during the year. So, an at-home program of water or vegetable broth fasting, start with like 3 days, just over a weekend, Friday, Saturday, and Sunday. And you could do that like every other weekend and see if you don't start feeling better. And maybe once a month, do a 5-day or there. Don't go past 5 days. And see if those don't help. You may, if you have not checked one of if you don't know Dr. Brooke Goldner, Goldner, go to her website called Goodbye Lupus. And she can help you overcome your autoimmune disease as well. She's got a remarkable philosophy. She's a great example as well. So set up a program of brief intermittent fasts and go to Dr. Brooke Goldner, Goldner website and join her crew and see if she can get some more practical information for you.
Thank you. Next up is Sylvia. I'm going to unmute you. Please ask your question.
Yes, thank you, doctor. My husband has prostate pain. He's had it for over 3 years. He's had MRI, CT scans. He's been checked out thoroughly to rule out any serious issues, but he continues to have extreme prostate pain. He is just miserable. And he is Whole Foods plant-based he has been for about 1.5 years.
So he's having prostate pain, you're saying?
Yes.
Does he have a prostate cancer or not, as far as you know?
No, he does not.
He does not.
They've
Right.
tested him for everything. His
Right.
PSAs come back, great. And like I said, he's had MRI, CTs, and CT scans. They haven't found absolutely nothing. And, but yeah, he has some very bad pain.
Well, this is a really subtle, complex issue here, because you wonder, where's the pain coming from? Is this to put a finger in the rectum and push on his prostate. Does he go ouch or doesn't he? Is the prostate itself tender, or could this be referred pain coming from the spinal nerves that he's feeling in the prostate, but the problem is really up in the lumbar vertebrae or the sacral vertebrae? He needs an MRI of his lumbar sacral spine for sure. He should have an MRI with contrast, with intravenous contrast injected, to look at the blood vessels to the prostate. He might have a blood clot in one of the veins in the prostate gland. There might be an infarction of the prostate where he's lost some tissue there. This might not be prostatitis at all. I'm sure that's what they're thinking. I'm sure they've given him antibiotics that haven't helped. So this pain, as you described, might be coming from somewhere else altogether, from a nerve impingement or blood clot or something else. So get an MRI of his lumbar spine and an MRI of contrast of his pelvic organs, and see if the radiologist can identify some other source for the prostate pain that he's feeling.